seeing these patients improve in their diabetes and hypertension metrics, and the overall cost for these very sick patients is a 72% cost reduction. So opportunities exist. Another one of the areas that was mentioned is the opportunity to do something called specialty consults. Specialty consults is when we reimburse specialists to consult to primary care providers, which are available to better manage chronic diseases. As Susan mentions, 80% of spending in healthcare is around chronic diseases. So this is a big area of opportunity, and investment in innovation is critical.
Now, to make all this happen, to be able to get to a place where we are coordinating care more effectively and actually treating the underlying causes of disease, you got to have information. Providers have to have better access to information. They have to have complete information about their patients, their entire history, if at all possible, so they can make informed decisions. Let's face it, in Puerto Rico, that does not happen. We do not have in Puerto Rico, after tens of millions of dollars invested in technology to provide interconnectivity amongst providers through electronic health records. That does not happen today. So individuals have to literally carry their records from provider to provider to provider, and some providers don't have access to information, which can lead to medical errors. It can lead to excessive orders of tests and procedures, and all this drives cost, not to mention the impact that it has on outcomes. This is also the jurisdiction in the U.S. that has the lowest adoption of electronic health records in the United States. There's still a lot of providers billing on paper. There's still a lot of providers charting on paper. And what that does is it adds to the administrative burden of the provider, which means they have less time available to actually work with patients. So improving the underlying technology infrastructure that these healthcare workforce operates in is going to be critical to enable the coordinated care that Maria described, and ultimately bend that cost curve and bring costs down, particularly for those sickest patients that have to be seen and require collaboration across multiple providers for them to receive effective care.
One of the things that I would highlight, and I know that the current administration has spoken about this, not just last year, but currently in the last couple of months, is how do we work with laws and regulation that adversely impact healthcare workforce supply? For example, how do we expand the limits that we currently have with access to telehealth so that we have telehealth providers that can give telehealth services to patients in Puerto Rico? How do we reduce the limits of use and scope of practice for physician extenders, nurse practitioners, physician assistants? How do we find a way that to innovate our regulations that right now create burdens, protectionists, and limits the ability to access or to support the current providers that we were currently have in the island that are doing everything they can to provide services. And I know this is something that we've heard, the incoming government talk about that, as well as the incoming Secretary of Health. And I think this is an area that we can look at. We met and we looked at all of the laws and regulations. And then here quickly just highlighting the fact that we have, sometimes there's unintended consequences to certain policy initiatives. And we'll briefly talk about two. For example, we know that the payment model is not adequate to support our, provider healthcare network. However, by increasing the reimbursement rates for one line of business, Medicaid, by increasing the Medicaid rate increases, it created an adverse effect into the commercial side of the business. So physicians have right now there's limited access to physicians for individuals and commercials that are outside of the Medicaid, Medicare Advantage plan that are in the commercial, which is our working class, our small business owners and then that increases an increase in obviously premiums over commercial side. And here you see also the fact that the tax incentives that were implemented did retain the providers in the island. We looked at the data and we also, of the licensing for the past 10 years, but we also did a survey and more than 92% of the physicians that took the incentive law were already in Puerto Rico. So obviously it supported their practice, but it didn't have the effect of necessarily of the bringing new physicians into the island. So we talk about some of the recommendations of how we create incentives that focus more on making sure that we support those new doctors that are coming in, either recently graduates that are coming in the first couple of years.
With respect to training, We do have to commend academia for its efforts to produce high-quality residencies. This is actively happening, and we are seeing expansion. However, we need to look at the problem from a broader perspective. On the one hand, our highly trained physicians and nurses who obtain on-the-job and robust training are being actively recruited by other states where they have better benefits, better pay, and what they do very well is make sure the licensing and the credentialing is available the day the graduate is done with their education. That is what we are competing against. And as Annie mentioned, and our graph shows, our folks are waiting 3 months without any revenue after they graduate because they can't get the credentialing and the licensing. So that is a big issue with respect to retention. At the same time, there are other programs that do not have residencies. Some of these are for general physicians, some of these are for nurses. And what we are hearing from hospitals and primary care providers is that once these providers are recruited, they take a lot of training, which increases the costs of practice.
So we say funding for last because it tends to be the most controversial subject. And it is clear, and it is beyond well documented, that Puerto Rico does not have the same level of funding for healthcare services than the typical state has. And we don't want to get into that here. But I would echo what Executive Director Mojica said earlier about in an environment where you have constrained funds, you have to make difficult decisions about how you allocate the funds and how you justify the use of those funds and how you coordinate initiatives to take maximum advantage of those funds. We have some recommendations coming up related to that. But it is without a doubt that the funding challenge creates some of the unintended consequences that Annie described before. Providers obviously are going to look to maximize their revenue to stay in business. And they might gravitate towards the program or the payer that actually pays them the most, which can create then imbalance in terms of access to services. So we recognize that funding is a challenge, and we should, of course, continue to lobby for additional funds. An argument that I've made in conversations with my colleagues here is, and hopefully this is something that a congressperson will understand, if somebody lives in Puerto Rico and decides to move to the U.S., the Medicaid program that actually takes on that individual will have to spend 3 times more on that individual than what they spend in Puerto Rico. So it would behoove, one would think, Congress to allocate more funding for Medicaid in Puerto Rico to prevent that from happening. That is the kind of argument that we should be making to Congress. But at the same time, we have to make the most of available funds to better make the case for additional funding. So funding is complicated, we know that, but we should first focus on how we can make the most of existing funding so that we can more easily make the case for additional funding. And that leads us to recommendations. And this might be a little hard to read, but we bucketed recommendations into these 8 categories. And we should start by saying that while we know we presented a picture that's less than positive, it is not an impossibility to address these challenges. We believe that we need to, though, focus on 2 types of initiatives. We have to address the demand side of the equation while we also address the supply side of the equation. The recommendations that will be focused on demand should be focused using the old Pareto rule of early interventions on impactable health issues and smarter use of healthcare resources so that we're targeting that 10% of the population that consumes 80% of the healthcare resources. And as it happens, as both Dr. Manning and Maria noted, those conditions, for the most part, are impactable. You can prevent chronic kidney disease. You can address or prevent diabetes. You can hopefully address asthma and other respiratory conditions before they become severe, and then you gotta be stuck with a can of oxygen. These are controllable, impactable conditions that through better coordinated care, where you bring primary care physicians, specialty physicians, insurance companies, and hospitals together, you can drive down the cost of care, as Maria noted. So all of these recommendations that we're talking about that relate to demand are focused on addressing those impactable health conditions and making smarter use of available resources to improve coordination. On the supply side, we got to look at all the factors that drive supply. We got to look at the quantity, and we got to raise the quantity of particular providers. We got to address availability, make sure that they are open for more hours. We got to address capacity so that if when they're available, they can actually see more patients and not be submitting bills or documenting or spending time on administrative stuff that they shouldn't be spending it on. And we got to make the provider more accessible to the patient through telehealth, through opening more locations in the parts of the island that are more underserved and encouraging that so that they're not all pulled in San Juan and Bayamón. And we have to ensure that these supply initiatives are looking at what the demand is going to be 10 years from now. We cannot chase current demand. We got to look at what demand will be in the future because a lot of these programs take time to be implemented. So with that, we came up with these 8 categories of recommendations around more targeted condition, financial and tax incentives, around increasing supply through the liberalization of laws and regulations that Annie alluded to, make it easier for providers to offer telehealth services, for example, establish greater coordination of workforce development programs, because again, the funds are limited, so we got to make the most of those. Re-engineering administrative process so that a provider doesn't have to wait 6 months to get licensed or a year to get credentialed by an insurance company. Those coverage and payment policies that encourage coordinated care. Let's invest in critical healthcare infrastructure. Long-term care, as an example, is sorely needed in Puerto Rico. And in the United States, Medicaid is the primary payer of long-term care. So if Medicaid covers the service, the supply will come. You got to have the funding so that the supply is realized. And again, we're going to make some challenging decisions about how we allocate the funds. And we got to make sure that every opportunity for healthcare funding that's available is pursued. There is unfortunately a history of Puerto Rico missing out on federal healthcare funding opportunities for a number of reasons. That cannot happen in the future. We got to avail ourselves of every dollar of federal funds is available. And with that, I turn it back to Arnaldo.
Oh, thanks a lot, Gobernadora. Mucho trabajo que tenemos por adelante. So anyway, thanks for the FTI team for the report. Obviously, this is the first step in addressing some of these gaps. It's been a challenge to address them because we didn't have the data. So this information allows us to be more strategic and more specific. Not all gaps are the same. Not all the gaps are the same within the island of Puerto Rico. So we need to be strategic with the limited resources that we have. And although the picture is grim, there are things we can do together with the government that are what many people call low-hanging fruit to start addressing some of these gaps. And we are, with the next step of this process is we are going to be meeting with the government, with the chief of staff, and with the Secretary of Health and the team to start working on how we go about implementing, how we go about sequencing some of these recommendations, and we can start closing these gaps so we can have a stronger healthcare system. So, Mr. Chairman, Mr. Executive Director, we finish here with the report of FTI.
Thank you, Arnaldo and FTI for your presentation. Would Robert or any board members like to comment on the presentation?
I just want to make one comment. One, I want to thank Arnaldo and the team for the thorough report. You know, it's an honest assessment of what things are, but it also represents an opportunity for us to be able to deal with what we're seeing in this report. We asked that the reason for this report was to inform the government of what things look like. So when we decisions on resource allocation, we can fund the initiatives that we think are going to make the biggest improvement or make change. We do have an opportunity to provide additional funds. We want the government to be able to, they've already established healthcare as a priority. And we just want to make sure that the allocation of resources that we have to put into the healthcare space goes into things that are actually going to result in some meaningful change. So we want to work with the government on identifying resources to fund initiatives. And this is a real opportunity kind of to take the step forward and do that in this year's budget, right? And the ones coming forward. So this is just the first step, and this report belongs to the government of Puerto Rico. And you know, and the team is available, right, to everyone, right, to follow up. So thank you.
Anyone else?
Yeah, I have a few comments. So first and foremost, thank you to the FDI team. As you all know, in our internal meetings, I was quite intense about all the information and gathering that data. What I do think, and actually this is a great opportunity for the government, the board to work together, and the private sector. Very similar as what I did when I was the president of Chamber of Commerce, when our now governor was resident commissioner. We worked together and we actually pushed forward and kind of avoided and got higher capital for the Medicaid cliff. So I think taking this data, putting it together, working together with the government and the private sector to go and advocate for the issues that we will be facing in 2027 about the Medicaid cliff is actually an opportunity that we definitely should act proactively for. So just wanted to, once again, thank FTI Consulting for being here and thank you, Governor, for being here. And that's pretty much regards to my comments. So thank you.
Governor?
Thank you, Mr. Chairman. Yes, I want to comment on so many areas. Not trying to extend more than the study. Obviously, we share many goals that are implemented in this study. The reality is Puerto Rico depends federal funding for most of the programs regarding healthcare. And that reality brought me, when I was a member of Congress, actually, I came to this board to explain the areas and bills that we were requesting having support because we're losing a lot of physicians to Florida. They move there, they don't have credentials they need to file on the island. But of course, completely different. The way Medicaid program pays them on the island is completely different to the way they're being paid in other areas. For example, you were talking about long-term care, which is one of the mandatory programs of Medicaid. It is not accessible on the island. So we can be talking about the 2021 programs that may be mandatory on the island. We just got 17. We keep adding some of them is because of the surplus of funding we actually granted on the deal we did in Congress that is going to be extended until 2027. So we need to begin that process with Congress already to negotiate and trying to extend the allocation of funds that we do have. And during the past, the board was instrumental on the first deal. I remember we got problems establishing fraud units on the island regarding Medicaid. That was one of the main considerations at the Senate at the time. And those goals were fulfilled and we received the rest of the funding. So those programs are still in place. That's one of the things that is in our platform. We went to that end. Permitting and the streamline of the process it's necessary as well, and extending the amount of students of medicine that can be on the island. So we just opened a program of surgery and neurosurgery on the island. So we can even provide to the board, because I don't want to myself on this issue, but I do know this is the most important pressing issue on the island. We're losing people that are moving to the States, not because the beaches are better, because of healthcare, specifically aging people on the island. So yes, I agree in some of the areas, and we're going to be working on some of them at the state level. So thank you.
Thank you, Governor. All right. There being no further comments or questions, we now have concluded the substance of today's meeting. I understand we have time for a couple of comments from the public. So we can now turn to the public commentary.
Yes. Hi, Mr. Chairman. We have two petitions. You can come forward.
Good morning. My name is Javier Ruajovet, Chief Policy Officer at CESA, the Solar and Energy Storage Association of Puerto Rico. Governor, thank you for your support of industry in the past as Resident Commissioner. You filed bills as Resident Commissioner to keep the lights on for Puerto Ricans with solar energy, and also as Resident Commissioner, you were a co-leader in requesting this board to net metering. So thank you for that. To the fiscal board, chairman, executive director, members, we want to collaborate. before that, I want to say Cameron McKenzie, great addition to the board, Puerto Rican that has a public interest always in front. Short story that I want to say here, I was a stakeholder when for stakeholders, and we 17 because it was 2007 with no end. Puerto Rico was about to enact a 40% renewables law. We were supposed to be 40% by this year. But then the fiscal board, emissary, the prior executive director of the fiscal board, sent an emissary to that Senate to say, basically, we will not support this unless net metering is changed. And that became a lot of pressure into the senators. But then that became kind of a deal that was written into that law that net metering was going to be taken, there's going to be a fresh look at net metering in 2024, back, in the far future, 2024, Puerto Rico will be on path to 40% renewables. But we're not there. And we're not there in partly because even despite the fact that the fiscal board keeps talking about their defense of the fiscal board undid over 400 megawatts of large-scale solar that were approved by the regulator. And that's part of the reason why we're not close to 40%, and that's part of the reason why none of the RFPs succeeded. And now, using that similar narrative, now they're saying they're defending the regulator by attacking at the end of 2024. My request to the fiscal board is please withdraw this lawsuit. It's a wasteful action, prejudice. And my request to the governor, and we've asked before, and she's always been a supporter, if the fiscal board doesn't do this, that case is submitted, there might be a negative decision by the any moment. Our request is keep fighting, appeal that case, ask for a stay of that decision if it happens. And I think no one wants litigation. I think there's ways out of this. We always want to collaborate, but we have not been giving, at least by the fiscal board, the chance to talk about this in a rational way. So that's our request. We like to collaborate. We don't like to fight, but we need to keep the lights on in Puerto Rico. Net metering, the 1 gigawatt of solar already in people's roofs, helping stop 25% of blackouts for everyone. And we're focusing in the only policy has been successful in Puerto Rico. So that's our request, and thank for the opportunity.
Thank you.
Thank
We have another gentleman here. Please stay to the limit time. Thank you.
Buenos días. Disculpen, pero esta vez me voy a dirigir a ustedes en español, ¿no? Agradezco la oportunidad de poder hacer este comentario. Señora gobernadora, solo unas palabras para felicitarla en su victoria y agradecerle su compromiso y con la energía renovable distribuida y miles de mujeres y hombres puertorriqueños que trabajamos en esta industria. La energía renovable distribuida, lo que también se conoce como rooftop solar, es una industria local que ha instalado placas y baterías a cerca de 200,000 hogares y negocios en la isla, con una inversión de sobre 6,000 millones de dólares de aquí de Puerto Rico y la creación de más de 10,000 nuevos puestos de trabajo. Sin duda, este es el mayor emprendimiento del capital y los trabajadores puertorriqueños en nuestra historia. Este es un logro de puertorriqueños mejorando la calidad de vida de los que vivimos y soñamos en Borinquen. Gracias, gobernadora, por su apoyo.
Thank you.
Another one. Okay, go ahead.
Thank you for the
the opportunity. My name is Alex Ortiz. I'm a disabled combat veteran, both Iraq and Afghanistan. And Governor Gonzalez, I appreciate everything you've done for veterans over the years. I'm here because I want to make aware to the board. Since I have only 2 minutes, I had a little bit more, but there's 69,000 veterans here residing in Puerto Rico, which bring $2.2 billion in annual spending from the Department of Veteran Affairs. 34,866 veterans have a disability rating, and they bring $1.1 billion in net income that's spent throughout the whole island. We have 3,122 veterans bringing $53 million to education around the island, higher education. Puerto Rico and University of Inter-American University get the most funding from this. We also have Vietnam veterans, which is our largest population, and their ages complicate the situation because they can't really advocate for themselves. I mean, we can't pretend for them to go be forced to serve during the draft and then come back home and not be taken care of. So the Office of the Ombudsman has been underfunded, understaffed for many years, and it's something that the governor has addressed to us, and she's making sure she has a plan established that I hope it comes to fruition, which is the reason why I'm here. Mainly, the ombudsman has the ability through the law, I think is Law 79 of 2013, to go and fight for us either in a state or federal forum. We have no representation in Congress in terms of directly to the House or Senate Veterans Committee Affairs. And this is a job that the Office of Ombudsman could be doing, right? They know they have the data, they have the capacity and law to do it. So I ask that you work with the local government to establish these benefits for veterans so we can continue bringing more funding for them.
Thank you for your service.
Thank you for your service, sir.
Yes, Rob,
Yeah.
go ahead.
Just to respond to a couple of the comments. One, on the speaker who just came up now. We haven't seen this proposal yet, but we will work with the governor on this proposal. We're doing the budget right now if additional resources are necessary for that, right? This could be a priority for the board, and we'll talk to the board members. So we'll pursue that in the budget process. So we look forward to getting that proposal.
On behalf of all of us, thank you for your service, and thank you for bringing this to our attention again.
Yeah, and thank you for your service. On the issue of net metering, or really Act 10, the board's position, just to be clear on this, is not related to net metering. What Act 10 does is takes away the ability of the independent regulator, which becomes more important now than ever before. The independent regulator is relatively new to Puerto Rico, and it's maturing as an independent entity. It was established in Act 17 or before Act 17, reinforced in Act 17 for the purpose of making decisions outside of the political process. So we just want PREB to actually make a decision based on their own data with regard to this. Whatever they decide is what we should move forward on. One of the issues with moving forward on some of the renewable projects, right? This is a cost issue, right? Some of the projects in Puerto Rico happen to be among the most expensive projects in the country. Some, not net metering. 3,000 to 4,000 people are doing ones on homes right now, and we're very much in favor of those projects. And we have approved 1,000 megawatts. Have been approved so far. Many of those projects aren't, besides the rooftop solar, which are the most successful, and those are actually going and continue to go, and we encourage them. Besides those, many of the other projects are really slow to get done, whether it's permitting, right? Whether it's the bureaucracy between the individual energy companies, those need to get done because they have been approved. And many of them are going to take 2 years, if not longer. Some of them have been in development for 3 years. So there's two parts of the process. One is approving these projects at an affordable cost, and also making sure that the ones that are approved actually get lit and actually begin producing power, because they're not. And we hope that the 3,000 to 4,000, right, projects for the rooftop solars, right, continue, but we just want to get the information from PREB and make sure that they have an opportunity to opine publicly like the original law envisioned.
Thank you, Robert.
Thank you. Chairman, we receive several questions related to collective bargaining agreements that the Oversight Board is currently reviewing right now, and we will answer each question in detail in our website.
Thank you very much. There being no further comments or questions, we now concluded the substance of today's meeting. I understand it'll be time for a press meeting after we conclude. I'd like especially to thank Robert, our staff, Governor Gonzalez and her administration, and all of you for joining us today. As I mentioned earlier, we'll be handing any additional comments and questions through the Oversight Board's website. Does any board member have any other matter to discuss today? Since we have no other matters to cover, do I have a motion to adjourn this meeting?
Mr. Chairman, I move to adjourn the meeting.
Thank you, Andrew. Do I have a second?
I'll second.
Thank you, John. All those in favor say yes.
Yes.
See.
Opposed? Abstentions? Our meeting is then adjourned. Thank you.
¿verdad? Buenos días a todos todavía. Good morning. We will start our press conference. We will start here. Any questions? Telemundo.
Usted habló sobre el asunto de los maestros y quisiera saber si hay una posición de la Junta sobre la disparidad en una preparación de bachillerato y maestros que tienen preparaciones de maestría y doctorado que están recibiendo compensaciones menores que aquellos que reciben compensaciones de bachillerato, lo que contradice, ¿verdad?, el principio de la carrera magistral, que puedan continuar estudios y puedan recibir cierta remuneración adicional. Posición en el contexto de lo que habló de mejorar el sistema educativo, de mejorar las maestros, de atender ese asunto.
Yeah. Education and the teachers are the priority in education. So that's number one. And I think that's demonstrated in the fact that teacher salaries have gone up almost 40%. There's been 3 separate times that teacher salaries have been increased 40%. But you're right, the way it was increased last time, and the government actually did this with federal funds initially, and then adopted those increases. But the way it was same for every teacher, no matter whether they had a bachelor's or a master's degree. And that's probably not ideal, right, when you're doing the salary structure. The first thing for the Department of Education is we need to understand how they're going to manage with the resources, and the non-recurring resources go away. And when it comes to the teacher salaries and evaluations, that is something that we want to work on with the government and establish a system like in civil service reform where there are requirements, right? Whether it's educational requirements, whether it's performance requirements, additional education. And if we're going to do an increase, have it related to those kinds of things. So it is something that we envision working on over the near future with the government.
Thank you. WKQ.
Muy buenos días. La población mayoritaria en Puerto Rico son personas mayores y también hemos visto que muchos profesionales tienen que dejar de trabajar para poder cuidar a sus familiares envejecientes. En ese aspecto hemos visto a municipios que en este nuevo año, por el nuevo cuatrenio, ya no están brindando porque no cuentan con los fondos federales suficientes para brindar lo que es el servicio, por ejemplo, de amas de llaves. Así que, ¿qué prioridad, si alguna, o qué medidas estarán tomando ante esta realidad que afecta también la economía de Puerto Rico?
Yeah. We agree with all of those statistics because those are the facts. And that's also why in this year's budget, the one that's current, for the first time, we added $15 million specifically for municipalities to fund the Ama de Llaves program, and they received 0 funding from the central government for their efforts on that program. Central government has their own program, but the municipalities have been filling the gaps, and that's why we gave them $15 million this year. As federal funding goes away, this is part of why we're saying we need to do long-term budgets and multi-years, because it's not enough to solve the solution this year, because as federal funds go away, they're going to leave gaps. And we have to have a real assessment of what are we going to do? Are we going to cut those services? Are we going to try to fund those services? And where are we going to find the resources to do that in this environment? And that's part of the long-term budget strategy that we want to work on with the government.
Another question.
Yes. En el aspecto de ¿cuánto tiempo tomaría ver, por ejemplo, que se estén implementando esas designaciones de fondos para los municipios? O sea, ¿cuánto tiempo consideran que se puede ver? Porque hay una necesidad actualmente que viene siendo como una emergencia para esos familiares. So, ¿cuánto tiempo prevén de que si este año, si el próximo año, si en 6 meses?
We already gave the municipalities their allocations for the Ama de Llaves program. So if it hasn't gone to the municipalities yet, then that's probably something that we need to work on with the central government, but it was recently made. That decision was just made. Then it goes, OJP has to make the decision, and then they have to distribute the money to the municipalities. But our decision on who gets the money and how that money has been will be distributed is already done for this year. And now we should start working on what we're doing for next year.
On another topic,
Thank you. Referente a estas medidas que está tomando el presidente Donald Trump de buscar que sean los estados, igual que los territorios, que estén a cargo de lo que es el sistema de educación. Así que sobre ese particular, ¿qué medidas, si alguna, están visualizando ante la eventualidad que la Casa Blanca está evaluando?
Yeah. Look, it's unclear what's going to happen in Washington with regarding to the Department of Education. But the first thing that we know, right, because we can't plan for the unknown, but what we do know is the federal funding that we do have is expiring and is going to go away. And it is a significant portion of the department's budget. So we will be asking the department for a plan like they always had before. There was a plan, a 5-year plan previously, and asking them for a plan or how will you manage in the absence of those federal funds? And then if there's anything else that comes out of Washington with the Department of Education, other municipality in the country, we're going to have to manage to that.
thank you. We have vocero here.
Buenos días. ¿Cómo reacciona la Junta Fiscal a la solicitud de parte de los grupos para que se levante el stay en el caso de la bancarrota de la autoridad y las críticas que ellos lanzaron hacia el plan fiscal certificado?
It's currently being reviewed by our attorneys, and I'm sure we'll get a recommendation from them shortly to how to react.
La Junta se va a oponer a la petición del equipo de mediación de contratar una firma de asesores financieros a un costo de $1 millón mensual, cuando el mismo plan fiscal establece que todo lo que genere la autoridad debería ir a los gastos operativos y a las mejoras.
Yeah. So just to be clear on that, because it's been reported that that is the board's contract. You're right. That is not the board's contract. The board actually specifically said, right, we're not negotiating that contract. It was negotiated by the mediators. The mediators and the board as the representative had to present it to the court. And that is the entirety of that. So the mediators had that negotiation, that their advisors, we didn't negotiate that contract. And the mediators are entitled to the professionals that they think are necessary for mediation. The question is, right, perhaps, right, how long, right, will the mediation stay in place for?
Just the history of that process, when a court ordered mediation, selected the mediations, et cetera, the professionals' retentions, the mediators asked the board to facilitate that process. And that's why the board is involved in filing with the court, et cetera. But they're not our advisors, they're the mediators' advisors. And it's up to the court in examining the request to make the judgment.
Okay. You have another one? I have a follow-up here. Go ahead and then follow up.
Pero eso quiere decir que la Junta Fiscal como tal entonces no puede oponerse a la solicitud del equipo de mediación para esa contratación.
No. It does not mean that the board cannot oppose it.
Thank you, Chairman. Follow up here.
En el mismo tema, la gobernadora ha expresado reservas sobre esa contratación y ha dicho públicamente que quisiera entender, ¿verdad? La gobernadora, presidente, se ha opuesto a esa contratación. Dijo ayer públicamente que no conocía los propósitos de eso, si era para seguir litigando, si era para resolver finalmente. O sea, ¿qué explicación le dan a la gobernadora sobre lo que va a ocurrir con ese contrato en términos de la mediación y qué pasa con esas objeciones si ustedes las reciben? ¿Cómo las reciben?
I mean, the governor can't, if the governor's office is opposed to what the mediators have proposed, right, they are welcome to object to it if that is their position, on it. Again, we advanced it through that, and I'll leave it up. Arthur, do we need to go through if she wants to object to that
Oh,
contract? Do we have to advance there, or does it have to go through us, or can they object to it on their own?
They certainly have a right to object to it, like, well, let me not answer the question until I fully understand it. The question is, do the mediators have the right to do what?
Does the governor have the ability, does the governor have the
I'm
ability
sorry, okay.
to object to it, and does that objection have to come through the board?
The governor's objection, no. The governor has proceeded, each governor, since the inception of the board, has proceeded separately in terms of exercising whatever rights they have within the court. They have their own counsel that can process it. What I describe with the mediation is really just a simple convenience or process that the board assumed. But certainly the governor can take whatever position she deems as appropriate, and has the lawyers and has often presented matters before the court, objected to things before the court, including objecting to any matter throughout, whatever it's PREPA, the Commonwealth, et cetera.
Thank you, Chairman. We have from Octus Kevin Mead another question. Kevin, go ahead.
Thank you. Thank you. In relation to the PREPA fiscal plan, how confident is the board in the system operator expense estimates, given the apparent operator shortcomings that have been reflected in various PREP proceedings? And secondly, what is the status of the board's plans to hire an independent consultant to pressure test those expense estimates?
Yeah. The operators have been in place for a few years now. They're in the best position to understand what the system need is. So that's the best information we have, right? We know for certain that the system is in a state of disrepair, right? By the number of outages you have. So as a fact, the system is in a state of disrepair and needs probably more resources than it currently has. The best information that we have is from the operators, which includes the system operator on the generation side. It includes PREPA and the TND operator. That being said, PREB is also in the middle of a rate case. They're going to be getting some of the same information or asking for some similar information of what the system needs. The board has also retained an independent evaluation because we also want to make sure what the system needs. But we do know as a fact that there is no evaluation of the system needs, and it hasn't been done for over 30 years. And we also know that in 2017, when there was an evaluation in terms of a rate order, the government acknowledged at the time that the resources identified in that rate order would be insufficient to fix the system. So clearly, if the resources in 2017 were not sufficient, they can't be sufficient in 2025. So those are the facts. But again, in terms of the systems operators numbers for all of them, we have another verification process, and we have PREB looking at it as well. And this is the best information we have at this time.
Can I just add to
You said
that?
you did hire a consultant. Can you say who that is?
I don't have the name. I don't have the name of it right now, but we can get it to you. We can get it to you. Yeah,
later.
we can
Go
get it to you.
ahead.
Can I just follow up on that, because this was a very important to me as a board member. You know, we've been through a lot of territory on the negotiation with the PREPA bondholders. Excuse me. The main thing is we just wanted as a board another data point. It's not that we've hired somebody to pressure test the numbers because we don't have confidence. The numbers have changed and they've evolved over time as we've gathered more information. So it was important to get another data point to look at the numbers, have somebody independent come in and look at the numbers that would just give us additional information by which we could make sound decisions on moving forward.
Thank you. We have Cyber News.
Saludos. Mujica, precisamente sobre el plan fiscal, la gobernadora además ha sido bastante vocal diciendo que esos números que ustedes sacaron son incorrectos, que ha sido también bastante vocal en el asunto de que no aunque yo usted lo atendió de que no le avisaron sobre el particular y que ella no tuvo tiempo de revisar los números, pero sobre todo de que esos números que ella entiende, ustedes llegaron a la conclusión, están errados. ¿Les preocupa a ustedes o no les preocupa el hecho de que ella puede entonces oponerse en el tribunal a ese plan fiscal y entonces convertirse en un obstáculo adicional para lograr un acuerdo? ¿O les parece a ustedes que al final ella va a entender el plan fiscal y se va a allanar a lo que ustedes están presentando?
The fiscal plan was about over a year in the process. So just understand this is not something that the board came to right in a short time. Over a year, over 50 meetings, including meetings with PREPA, who has all of these numbers. The fiscal plans also undergo an enormous amount of scrutiny. So these are not the fiscal plan. People will review them, people will challenge them, people will scrutinize the figures. As Board Member Nixon pointed out, we look for a lot of different data points on it. And we hope to have continued conversations right with the governor to understand where they are. But as we always said, if things change, right, Act 17 law is still out there. There are changes there, right? And we will impact the final determinations, right, of the plan. But as we stand right now, those are the numbers that we have. We're confident in those numbers. And there will be scrutiny on the fiscal plan and we'll review what the governor's thoughts are. They have not presented to us any specific changes from the plan.
The issue with the fiscal plan too is it's a dynamic document, right? And you operate and it release the fiscal plan with the best information that you have. But the board is going to look at the numbers based upon the data that it has, right? And so I think it's important to understand that we're willing to, as we get more information, to revisit the fiscal plan. But as of right now, it's the best information we have.
I just want to make one point. The reason that we are saying that the system needs all of this investment is because we know that the system is failing, right? This last year, it got worse, right? The performance got worse, culminated in the New Year's Eve blackout, a system of increasing load shed events as well. The system has needs. The plan reflects an x-ray of the system. It is an honest assessment of what the system needs. There'll be debate around that. And obviously, right, the bondholders have a certain perspective because the less the system needs, right, the more is available for their recovery. But the priority here is making sure that the system has the resources over the long term so that it can perform and be reliable in a way that the people of Puerto Rico deserve.
Thank you, Secretary Director. We have no idea.
Mujica, you've been very emphatic on the fact that the power grid has been underfunded for a long time, and there's the chance that the Energy Bureau ends up approving what a so-called constrained budget through the rate process. What are your thoughts on that? On the fact, on the possibility that the Bureau approves budget in that way instead of the optimal budget that the fiscal plan actually reflects?
Yeah. PREB makes the final determination on what the rates would be. What the fiscal plan shows is that if you take into account the system needs and then take into account what the bondholders are requesting, right? 7 cents plus interest gets you to 10 cents. And then you take into account how much it costs to fund the pension system, right? 10 cents plus more. There is not enough room in the rate for the system to be affordable for the people of Puerto Rico. So that is what it's saying. PREB will make a determination as to how much the system needs and how much they want to put in the rate. And the question that the plan answers is, how much can you layer on top of that system need and still allow for additional resources to be available for debt recovery? And what the analysis shows is that there is not room to do that.
But how close to the optimal budget does the board believe that the eventual rate should be?
We're not going to second guess what PREB does, right? PREB is an independent regulator. PREB is doing their own analysis. We'll wait for them to do what they're doing. We had to do a fiscal plan. That was the job of the board, and that's what we did.
Okay. Go ahead.
The board at some point last year was beginning an analysis on the possibility of federal funding cuts, of course, with the under the Trump administration. Has the board finished that study, and how much of an impact could those federal funding cuts have already begun happening? What kind of an impact could it have on Puerto Rico?
I don't recall saying that we were doing a study of what the impacts cuts. We know how much federal funds the government gets. It's a significant amount of federal funds. We don't know if there are any federal funding cuts yet, right? So there is no determination on, right, what the impacts would be. What we do know is, as I mentioned earlier, 50% of the current budget is federally funded. We do know that. What we also know is that it expires in 2027, as the governor mentioned. Those are facts. The rest of it is unknown, and us, like all of the other states, are still seeing what happens.
Follow-up question.
Entonces, este nuevo presupuesto, se va a ver algo de eso se va a ver reflejado en este nuevo presupuesto, porque la incertidumbre, supongo yo que algo de eso se tomará en cuenta al momento de presupuestar para el próximo año fiscal, ¿o no? ¿Me equivoco?
Yeah, no, that's a really good point, right? And we can't ignore risks, right, that are out there. The government is in a far better fiscal position today than it was 8 years ago. Part of that is because of the debt restructurings and also the realignment of the budget. But we haven't done a budget cut in the last 2 years, and we don't envision one again this year. However, with the federal exposure, it is something that we need to take into account. And the limited resources that the government has, whether it's saved resources or growth going forward, we have to take into account the fact that, right, there is risk ahead. And what we don't want is for all the work that we've done over the last 6 years, right, to go away because we didn't manage to those risks. And just to your point, I've been 25 years doing budgets, right? I was a budget director for a long time. And we managed through crises without ever, right, not being able to fund the things we did. And you do that by prudent fiscal management and not ignoring, right, what's coming ahead. And that's why it's a great point. This budget has to take into account the fact that these things could happen and be able to manage it. Otherwise, we're going to be reopening the budget, right, and doing other things for that risk is critically important.
Thank you, Reverend. With the last question, Tenance.
Buenos días, quiero clarificar algo porque no sé si lo tengo bien con relación a la contratación de no ni la que propone la contratación con esta firma, pero quería saber cuál es la posición de la Junta sobre esta petición de los mediadores.
Chairman.
What the mediator said, a statement that was made or in the application?
Its position on that,
even though it's not our contract,
on that hiring.
We have to date not made a determination as to whether to take a position one way or the other. And we'll have to consult with the lawyers, but ultimately we can't give you a definitive answer now.
We have not objected to it. We have not objected to it as of now.
Okay, follow up.
No, tenía otra pregunta con relación a la pronta eliminación del fondo de equiparación. Algunos alcaldes están solicitando que ante la pérdida de esos fondos se aumente el dinero que nutre el fondo de servicios esenciales y que se agrande también el marco de uso, por ejemplo, más allá del programa para amas de llave. Quería saber, ¿eso es una posibilidad real?
I mentioned this in the remarks earlier. The government is now giving the municipalities $350 million. The municipalities are receiving now more money than they received when the equalization fund was in place. It's a fact. However, right, this year we added $89 million. We want to target it to make sure that it's going to provide specific services. Whether or not that funding is recurring next year is a conversation that we will have with the government. And then whether or not there are additional resources, also a conversation. Limited resources, but it's also a conversation with the government if we're going to do that. We recognize the needs of the municipalities, and I know there are some municipalities that are particularly distressed. And we have 35 million in unallocated resources that we could use for that as well. So there's two things here. We want service delivery for municipalities. We want them to deliver the services that the people need the most. We're funding those services. They're getting more money now than they were when the equalization fund was in place. Not all of municipalities, there's a different distribution, but overall it's a similar amount of funding. But the board has not been opposed in the past to adding funding for municipalities. We just want to make sure that they're being used efficiently.
Thank you. We have a last question, and I think John Marino was asking for it. John?
Hi, I was just wondering if you have commenced meetings with the Commonwealth regarding an external funding source for the PREPA recovery, and if Commonwealth funding is still a possibility.
We have not begun any conversations with regard to that yet.
Is Commonwealth funding still a possibility, including, I guess, the fiscal plan sort of has like I forget what it is, but nearly $900 million for unreserved needs in the TSA. Would that be something the board would consider?
I think as we said in the fiscal plan, we're going to look for any other resources that are available that we can discuss with the Commonwealth. What the fiscal plan is clear on is that there's insufficient room in the rates to support all of the system needs and the recovery that the bondholders are requesting. But we have not begun those discussions with the government yet.
Thank you, Robert, Chairman, and board members. We conclude our press conference. Thank you all.
Thank you.